The business of medicine is constantly changing. The review by Resolve discusses current contract issues for physicians, compensation trends, and tips for a successful career. Every physician's contract and career is different, and nothing in this episode should be considered legal advice. If you have specific questions about your career, please consult with an attorney. Now, on to the show.
Lauren Kaufman, welcome back to the review.
Thank you.
Yeah. So for anybody who hasn't seen one of Lauren's episodes before, Lauren's a healthcare attorney with Resolve. And so we're going to talk today about non-competes, which is a really fun subject.
So fun.
Yeah, so fun. Okay. So let's talk about, give me the basics of a non-compete. Like what generally, zoom out for a second. What are non-competes? What do they do? How do they act? Things like that.
Sure. So non-competes, I think in the sense that physicians are thinking about is a restriction on their ability to go somewhere after their employment has ended with whoever they might be currently employed with. So generally there's a restriction in both length of time and then also geographic area. And that can either be a radius or it could be a county or it can be specific employers as well.
Gotcha. So language in the document that says you can't work for a certain amount of time in a certain area or certain employers. Employers do this to protect their patient base. Is that the idea?
I suppose that's the common refrain.
Okay. So let's break these up into the individual, components. So from a time standpoint, post termination, how long are non-competes usually?
Yeah, I would say generally it's going to be 2 years is most commonly what we would see. I mean, I have seen 3 years, but really that's on the longer end. I did just recently see a 6 month, which I think is the first time I've ever seen that one. And so I would say, 60% of the time it's going to be 2 years, then 1 year, and then on the either end from there.
So usually 0 to 2 years is kind of the hopefully the normal range. Right. Okay, shorter the better, obviously, for our clients. Okay. From a geographic standpoint, like where you're not allowed to work, what you mentioned miles, zip codes, like how does that usually play out?
Yeah, and I think it's all a matter of whether or not a non-compete is in theory reasonable. It is a matter of relativity as to where you are, right? So I've seen in some of the more rural states 100 miles, and then downtown Manhattan 1 block.
Right.
So I think it definitely does matter. I would say both location and then also specialty. I think also comes into play as well. But generally, probably 10 to 15 miles is what we would see kind of generally in most places.
Yeah, so the reasonableness, I think, is based on like how many patients are in that area, right? So if in Manhattan, your example, there's obviously a lot of people that live there, good density, and so you can go 10 blocks away maybe and not really be competing as opposed to rural Kansas, right, where there might be one health system in 100 miles. So, okay, that makes sense. How about, you mentioned specialties. I've seen some contracts where they'll actually have like a table and they'll say for family medicine it's this many miles and for ortho it's this many miles.
Yes.
Is that common or is it more common to just have a blanket 10-mile radius?
I think it's more common to have a blanket 10-mile radius, but I do think that and there's been some movement kind of with states as well where they're trying to parse out primary care. Yeah. Primary care is harder to kind of maintain, so a lot of times there's lesser restrictions, but that's on the less common side. I think that almost always it's going to be the same regardless, but it does come into play. Okay.
So you mentioned states. So there's, anybody that's looked at non-competes in the last 2 years, right? There's been a lot of news. FTC, has been taking action on it. States are making different moves on this. What's the high level? Give us the background on the FTC, where that sits, and then what states are doing.
Sure. So the FTC, as it is right now, is nothing is happening.
Nothing. Okay.
So big, they came out. They had a big committee saying that they found the FTC found that non-competes were a unreasonable restraint on trade for all employers.
Right.
There were a couple of exceptions, but broad strokes, most of them.
Okay.
That has since been appealed and overturned on some state courts on the federal level, and now the FTC appealed it, but just recently in the past couple of months, they have stayed their appeals, meaning that they are taking a step back to determine whether or not they're going to continue to appeal it.
Okay.
Or as in defend the rule.
Yeah. So the FTC came out and said non-competes are bad. Let's make them go away.
Yes.
Some local cases came out that said it's too broad. You can't do that. The FTC was going to appeal. Now they might not appeal. So this means we're kind of back to where we were, right?
Right.
Okay.
Assuming your non-compete is enforceable.
Yeah. Okay. So
Yes.
let's assume they're enforceable, right?
Yes.
Except for there's certain states that have taken some action, right?
Yes.
To say that for physicians, at least specifically, there should be limitations, or they're, they're unenforceable in general. How often do you run into that where you're in a state like California that says physicians shouldn't have these, where employers are still putting them in contracts?
California, not as often.
Okay.
I think because it's been, I mean, it certainly does happen, but in the minority. I think because it's been around for so long. But whereas some of the newer kind of emerging laws, for example, South Dakota recently banned it. We did see some non-competes in those contracts. I think those are starting to filter out, though. I think that the biggest thing is being mindful of there's a shifting landscape as far as, where those legislation are kind of landing. And I think that the contracts are not always catching up.
Yeah. Yeah, and I think there's always questions on, are they retroactive, are they not, right? Does it apply to your specialty, does it not?
Right.
Are they just limiting time? Because sometimes they'll do that. They say that for physicians, it can't be more than 1 year, right? Or it only applies if you earn over $200,000, something like that.
Exactly. And there's a lot of those high income earners kind of exceptions that we're seeing. And so that is ultimately, not very helpful for our clients.
Right. Okay. So for physicians, the takeaway is on non-competes, what?
Assume that if there's a non-compete in your agreement, it's going to be enforceable, just kind of first glance. Then I would say, let's talk about what we can do to advocate to kind of take some of the teeth out of that in that language, whether that be reducing time, reducing radius or geographic restriction, carving out some private practice exceptions or, FQHC exceptions, and then also some exceptions relating to how the contract or your employment might end.
Perfect. So don't assume, don't assume that it's going to be unenforceable, right?
Yes.
It's probably going to be enforceable if it's reasonable. Try to get your exceptions in there if you can, limit it as much as possible, and then just make sure you're comfortable with whatever terms you sign off on.
And I think that at the end, a lot of times, a lot of employers are going to say, we don't want to necessarily make changes here because then that's going to limit our availability to kind of enforce it in the future, which we can discuss. But sometimes you have to look at that risk versus reward of what are those long-term plans and how is it going to affect you in the future.
Perfect. Good advice. That's our summary on non-competes. Thanks for coming on.
Thank you.